This is a Tallahassee update from the Florida Healthcare Association, brought to you by Bouchard Insurance.
Hi, I'm Emmett Reed, Executive Director of the Florida Healthcare Association. Welcome to another edition of FHCA's Provider Program, brought to you by Bouchard Insurance. The pace of the legislative session is fast and furious, and that was abundantly clear this week as FHCA worked to reach an apparent compromise with proponents of a Certificate of Need bill that was attempting to bypass a CON process to build nursing homes in a specific geographic area. We began with a press conference with Senator Rene Garcia, Member Deborah Franklin, Member Steve Bogomilski, and others addressing the ongoing points we've made in committee testimony that special exemptions are bad public policy, and the process is working to control costs to the Medicaid program while ensuring an optimum use of nursing home care based on demand.
As Florida citizens continue to age and our state focuses on how we're going to meet the demand for our baby boomers, it is important that we maintain a comprehensive and organized approach when it comes to healthcare planning.
Media awareness to this issue, the hard work of FHCA's staff and lobby team combined with member outreach to legislators appears to have resulted in a compromise which would remove the potential to negatively impact our members. While Senate Bill 1482 passed out of the Senate Judiciary Committee on Monday, House Bill 1159 was amended in committee on Thursday to include some mutually agreed upon provisions. FHCA will continue working with the bill's sponsor to ensure the final legislation considered on the House floor is one that maintains a fair process reflective of current CON law.
We hope between here and the floor, we will give you a bill that will be good public policy because it will be very tight criteria, very clear criteria, and it will be a process where the builder's involved, where the nursing homes are involved, but where the CON is decided by ACA, which is the proper way to do it.
Nursing home tort reform continued to advance this week, despite attempts to add unfriendly amendments to the bill. FHCA Secretary John Simmons waved in opposition to an amendment to increase the staffing ratio with no funding attached. Tony Marshall of our staff testified to the fact that Florida's nursing homes staff well above the national average and that as a resulting of that staffing flexibility passed in 2010, residents are receiving more individual time with nurses, which is important to their quality care. This unfriendly amendment was defeated and Senate Bill 1384 passed favorably out of the Senate Health Policy Committee. The bill has one more committee stop before it can be sent to the Senate floor. Members of Gulf Coast Healthcare hit the Capitol early this week for our final Lobby Wednesday.
I think we're going to make some impact. I'm excited to be here and happy to do long-term care good.
Today we're going to talk to some people and tell our stories.
We're going to be meeting with Representative Matt Hudson at 11 o'clock this morning, and we are reviewing some bills that he has co-sponsored and passed in reference to health care. So we're looking forward to meeting with Matt.
They were joined by caregivers from Southern Healthcare Management, Page Healthcare, Life Care Center, FHCA District III, and Valencia Hills Health Rehab Center from Lakeland, Florida.
We have several appointments today and we're ready to go.
Along with our sponsor, FarmScript, we had over 150 members in town advocating for tort reform and restored reimbursements. Long-term care professionals could be seen throughout the Capitol delivering the message about the important link between adequate funding and high-quality care.
We're in Senator Gates' office. We're here at Gulf Coast Healthcare, Lobby Wednesday, to thank the Senator for supporting us through the budget. We brought a lot of folks here to administration, and we brought a lot of our nurses here to the real boots on the ground, the ones that do all the work. So we wanted to make sure that he sees them and meets them and hears their stories.
They are the people that can tell you that take care of the residents day in and day out.
I love my patients and I would like to see that we continue to take care of them without budget cuts because our dollars are already being stretched.
With just 2 weeks left, FHCA continues to urge lawmakers to take the Senate position and restore much-needed Medicaid funding to nursing home care. Remember to keep following our Capitol Connection blog and our Facebook and Twitter posts to stay up to date on the budget and all the bills we're working. Until next time, I'm Emmett Reed, keeping you informed about the critical issues that impact long-term care and the providers we represent.